Hello Plymouth, Luke Pollard here. I'm running for re-election as your Member of Parliament. We know there's an NHS crisis in Plymouth. Our doctors and nurses and the healthcare professionals are working their socks off. But the truth is, there's simply not enough of them, there's too much privatisation and fragmentation, and there's not enough money going into the NHS. I want to change that. Behind me is North Road West Medical Centre. It's one of the surgeries that was featured on the BBC Panorama programme from a few months ago, talking about the crisis in GP provision. It's getting harder and harder to see your GP, and it's getting harder and harder to see an NHS dentist. What we know is that when you can't see your GP, people go to the accident emergency at Derriford. That puts extra pressure on Derriford. We know there's a crisis in social care, so some of our most vulnerable adults and young people aren't getting the support that they need. That's why we need real change. More privatisation and fragmentation of our National Health Service, as we've seen under the Conservatives, won't deliver the change that we need. We need proper funding for our National Health Service. That means making sure that we're lifting the pay cap for our doctors and nurses, giving them a decent pay rise. Labour wants a 5% pay rise next year for our National Health Service workers to correct some of the below inflation, the real terms pay cuts that we've seen under the Conservatives' pay cap. I want to end privatisation of our National Health Service and make sure that the Tories are never ever able to sell the NHS off to American healthcare companies. The National Health Service is on the ballot paper at this general election. If you re-elect me, I will continue campaigning to get us our fair share of funding as a city, and I will never, never accept the privatisation of our NHS. Thanks so much, Plymouth. See you soon.